we are going to discuss about allergies. Okay, what are the psychosocial impact factors of allergies? First thing, actually, whenever the person is more stressed, actually here caregiver role is very important. Okay, whenever the person is suffering with depression, anxiety, stress, okay, they are prone to get into more allergies. And not only that, when the person or the families are disrupted, if the person is getting into more prone to risk or bullying by the families or being bullied or any kind of post-traumatic stress, depression, anxiety, all these poorer quality of life leads to impact will be more on allergy. And at the same time, patient's family lives often are disrupted. That is also one of the reasons. Actually, even the food allergies are likely under-recognized. And a few people, they have food allergies. If they're eating that food, they will get allergy. And even the dust allergies, even the stress, and all those things. So here, when the person is impacting more to psychosocial factor in allergies, we need to avoid that kind of food, and we need to be in a stress-free environment, and we need to educate the family members also. Next, menstrual disorder. What is the impact of menstrual disorders? Okay. So here, when the woman cycle is missing or any irregularities in the cycle or any disrupted movements like chronic pains, all these things, it may lead to menstrual disorders. What are the things we will see? Few menstrual disorders like abnormal uterine bleeding. This is also one of the reasons. Excessive or prolonged menstrual bleeding, amenorrhea, the absence of menstrual bleeding. Few people, they don't bleed even in the menstrual cycle. And yeah, PCOD, PCOS, we can listen, they don't get periods, all these things will be there. And that is also cause of the stress. So here, when the person is suffering with abnormal urinary bleeding, excessive or prolonged menstrual bleeding, they need to see a gynecologist. Amenorrhea, absence of menstrual bleeding also one of the cause. Oligomenorrhea, light or infrequent menstruation. And fibroids, non-cancerous uterine tumors. Actually, when the person is suffering with fibroids, here we can go with the medication or we can go with the removal by operation. Okay. And premenstrual syndrome, PMS. Nowadays, this is the common thing. People, whenever they're expecting periods, they will say, I have PMS. PMS means physical and emotional discomfort prior to menstruation. They will feel body pains and even the emotional side, irritation, hesitation, all these things will be there. So these are called PMS, premenstrual syndrome, and a premenstrual dysphonic disorder, PMDD. Here, severe physical and emotional discomfort prior to menstruation. Actually, when the person is suffering with the PMD, they need to see a psychologist and a gynecologist, and they need to take care of the medicine. And a few other disorders will be there: clotting disorders, hormonal imbalance, okay, and uterine fibroids, and sexually transmitted disease, cancer. Due to cancer, also people will get one, and PCOS, polycystic ovary syndrome. Nowadays, we can see PCOS with many women. Even the school children also, they are suffering with PCOS. Okay, because of this is genetic also. And if the period comes too frequently, fewer than 21 days apart, not often enough, more than the 3 months apart, or lost longer than 10 days, even in that case also, it advised to see a doctor. And non-stop continuous bleeding when the person is in severe stress, that time also it happens. Now, risk factors. What are the risk factors? Actually, whenever the age is increasing, the menstrual disorders will be more. The girl, nowadays, people are maturing at the age of 10 and a half, 11. And yeah, so a few girls, they won't even mature by age 13, 14. Then also they have to see 14, 15. If the person is crossing the 15 years, they have to see a gynecologist why the menstrual cycle is not happening, why the men are not achieved by the girl. So here, risk factors, higher risk of severe pain, longer periods, and even the longer menstrual cycle. These are all the risk factors. And overweight also play a role. Even underweight also can increase the risk of dysmenorrhea, painful period, and amenorrhea, absent periods. We already discussed. So these are the risk factors we need to see individually, and we need to lower the risk factors. And we need to take care of the physical and emotional stress and the psychosocial aspects of menstrual disorders. Actually, 3 to 8% of menstruating women experience in more debilitating the menstrual cycle. Okay, PMS. Actually, here, whenever the people are experiences mood disturbance and physical discomfort in here, they need to see each menstruation cycle, and they need to check their depression and anxiety levels. Actually, this is not the common emotional symptoms of depression or anxiety. So, even the irritability also can interfere the normal functioning and relationships. See, if the person is suffering with irritation, they will show that anger on the family members. What happens here? Again, there is a disturbed relationship in the family. So here, irritability or depressed mood or anxiety or mood swings, whenever the person is suffering with all these things, they need to see a professional, and they need to take care of this. Nowadays, the medication is available, and they can see a psychologist, a clinical psychologist. They can go with the therapies also. Actually, 90% of the people, they have the mood effect whenever they are because of the crippling periods pains. Okay, and here we need to see what is the impact of their daily life, day-to-day life. If it is impacting, then they have to see. And yeah, unpredictable lead bleeding also they need to check. Okay, sometimes yeah, stressful times they will get heavy bleeding, and they will suffer a lot. So sometimes they don't have any kind of social support, like understanding friends and family members or partner also, they don't support the women. At the time also, she needs to do a lot of works, and social isolation will be there. And the financial worries, okay, even the financial worries also, it causes more pain. And if the woman is surrounding in a safe, not like not in a safe hygiene place, that also one of the problematic factor. I think I heard some story like in somewhere else. All the women, whenever they are getting periods, they need to stay in out of the house. They have a house. They build the villagers build a house. These women, they need to stay there. After completion of their periods, they have to come back. So here, food and everything they have to prepare. Actually, I don't know what kind of villages they are, how they are supporting the women. Okay, so these things we need to avoid. Women need a lot of help, and lot of help from the family members. How she can deal all alone by herself. Even other women are there also, but they are also going through the same phase. Okay, so these things we need to avoid. Now we are going to discuss about the psychosocial interventions for people with chronic health conditions. What are the things? Actually, whenever we are discussing, even the psychologists or physicians, nurses, physical and occupational therapists, vocational counselors, social workers, recreational therapists, all these things integrated to overall goals of rehabilitation. So you are working, they are going to contribute to help the client and to reach the next level, to help the person into the medical condition and behavioral and cognitive things. Okay, here, what are the approaches we'll see? First, psychosocial factors are often involved in patients failing to adhere their medical regimen. What are the conditions? So suppose if the person is not educated about the stroke or whatever the challenges he is facing, we need to make them to understand what are the self-care activities he has to do. And not only that, we need to help the person, so he needs to change the habits, and we need to give the prompts and reminders to help the person, to help the and we need to ask the patient to record everything, his habits, his daily activities, his daily routine, and what kind of activities he is doing. So here, we need to monitor his activities. At the same time, we need to educate the person to improve his overall health well-being. And we need to see the graphs. First, what are the things we can? Education and the social support, relaxation and biofeedback. Okay, these are the graphs and these are the charts we need to maintain. All the health professionals, whenever they're working with the clients, and the cognitive behavior methods, insight and family therapy. The person and the family, they need to have a insight. This is called psychoeducation. See, if the person is not understanding what is his disorder, what is his nature of illness, he can't. Even the family also. So that's the reason they need to have an idea of their insight of their nature of illness, and they need to understand. Even the family therapy also. Family also play a vital role whenever we are doing this. So here, all the people, all the family members, they need to understand. See, suppose someone is suffering with anger issues. Suppose if the person is yelling at others, the other family members also they're throwing on the anger. Here, what will happen? Aggressive nature will be more. So here we need to understand the person prospect and we need to help the person. Please don't do this and help the patient. So that's the reason we need to educate the family members. Then they will understand the person's perspective of the anger. They will try to calm the person and they will help the person to overcome the stress. Now we are going to discuss about the terminal illness. What is terminal illness? Okay, see, cancers, all these things will come under. Okay, so how to diagnose and what are the psychosocial factors and what are the psychological consequences of cancer we are going to discuss here. Okay, first thing, what is terminal illness? Okay, so here, terminal illness also called life-limiting illness. See, here the word itself is there, terminal. That means it's limiting their lifespan. Okay, life-limiting illness. It's a disease or condition which cannot be cured and result in the death of the individual. Okay, although not every case of cancer or HIV or AIDS result in internal illness, severe cases only it's there, the stages of the cancer, and even the AIDS and also HIV and AIDS also. The cells, abnormal cells multiply in uncontrolled fashion. Then, yeah, the HIV targets my immune system, then it weakens the person's defense system. It even affects on the infections of some type of cancer. So here, even the HIV AIDS also, if they don't have any kind of the cells are abnormally multiplying, if it is affecting immunity system, whenever it reaches the cancer, we need to understand, we need to educate the family members, and we need to psychoeducate the patients and the families. Then what will happen? They will understand the functions of palliative care as well as stress and burnout experienced by the caregivers. So here caregiver role is more. And not only that, whenever the person is understand his disease is limiting his illness, even the limiting his lifetime, then we need to understand his emotional and psychological trauma of the person. So now we will see what is the cancer and how its role play. Cancer is a disease. We everyone knows nowadays. We can see this. Actually, this in this cells will multiply in an abnormal manner and uncontrolled fashion and spread through the body very quickly. Okay, here this abnormal produces tumors called neoplasms. Actually, whenever we are discussing about the cancer, we call that tumors. So this tumors contains, it produces neoplasms. Actually, here two types of tumors are there: benign tumor and malignant tumor. Okay, these are the science terms we have to remember. Okay, benign tumor is non-cancerous tumor, but actually it invades nearby tissue, not spread to other parts of the body. So it's not that harmful, but it can be serious if it presses on vital structures such as the blood vessels or nerves. See here, it won't spread, but if it is in the blood, then yes, that is serious. It can be serious only if it is in the blood cells or nerves. Okay, here a malignant tumor is a cancerous tumor that can invade, destroy nearby tissue. Actually, this tumor will travel through the circulation near and distant parts of the body from a new tumor. Actually, this cancer coined by Hippocrates in the 5th BC. He was the one person who named it. Okay, so actually, this it grows and it spreads the whole body. It grows in one part and it spreads. Actually, here the cancer described many people like cancer is the leading cause of death globally. Actually, when WHO into, also done the survey globally, and 9.6 million deaths in 2018. Okay, and out of six deaths are towards the cancer. In the past, that was done by 2020. In the past 50 years, individual chance of developing cancer lifetime is increased manifold. Okay, so here the cancer rate is very high. Even the Spence and Johnson 2001, they also done the survey. Okay, actually, this next 50 years cancer developing rate is very high. The study is, and the survival factor is like 20 rate in the past 20 years. So here, whenever we are discussing about the risk factors for developing cancer, it depends on the factors like first thing genetic. Nowadays, even when people are looking for the matches, they will say, is there any cancer in your like psychiatric illness? We need to ask the cancer is there. And not only that, first is genetic, second one is background, third one is smoking behavior and diet. Okay, tobacco is the most and risk factor for cancer. Actually, it's responsible for 22% of cancer deaths. And nowadays, you can see even in the theaters, but they don't want that ad. Government is giving that kind of information now. Okay, but still, people they don't realize. Okay, and this infection caused by hepatitis and human papilloma virus. HPV, it's called. What is that? Cancer virus means human papilloma virus. Actually, this virus is responsible 25% of cancer cases in low and middle income countries. Okay, other major risk factors include like unhealthy diet, like physical inactivity. This was done by WHO 2020. Now we'll discuss about the type of cancer. Actually, here three general terms may be used for the cancers. Okay. So whenever we are discussing about the cancer, it depends on the broadly developed in seven types. Okay. First one is carcinoma. It arises from epithelial cells of the body and it forms covering layers over the external and internal body surface. And adenocarcinoma arises from glandular tissue. Sarcoma. It originates in supporting tissues, example like bone cartilage. And nowadays we can listen, we can hear many cases of bone cancer and all. So that is called sarcoma. And myeloma, areas from a bone marrow. Bone marrow defect will be there. They have to change the bone marrow. Even we see in many cases that the person is suffering with bone marrow. Okay, actually this one myeloma, it arises from bone marrow. Blastoma. This arises from embryonic tissue of organs. Leukemia, blood cells. It arises from the blood cells. And lymphoma, it arises from lymphatic tissue. Now, how to diagnose the treatment? How to diagnose the cancer treatment? Okay, actually, see, whenever the person, in most of the cases, cancer that may get delayed. So here, we need to see that also. When the cancer is screening objective, it's identify the like abnormalities that can cause cancer or pre-cancer who have not developed any symptoms. Okay, whenever we are seeing the FHPV testing like cervical cancer or mammography for breast cancer and pap cytology, okay, all these things are diagnosed by the medical history interview or physical examination or as blood test or most of the cases is done by the radiographic procedure. And ultrasound examination also will help you identify the cancer cells and identify the cancer. And interview and physical examination. And yeah, magnetic MRI, magnetic resonance imaging. Okay, this can also will help the person. And computer tomography, nuclear scan, and endoscopic examination. These are all will help the person. And needle biopsy, where a fine needle or core cutting needle is inserted into the tumor. And they will take the sample of the tissue and they will go for the biopsy. Okay, this is called a surgical procedure, but still, by this also we can understand and we can remove the surgically also. Okay, and this treatment of the cancer is multimodal approach, like chemotherapy, bone marrow transplant, we already discussed, biologic therapy, and hormonal therapy. All these therapies will be there. Now we are going to discuss about the psychosocial factors of cancer. When the person is into cancer, okay, and when the cancer is progressing rapidly, here depression and unhealthy lifestyle and negative expectations are linked with more rapid course of the disease. Actually, all these things mentioned by Mr. Lindsay Lewis, Rosenberger, Edger 2003, and Epstein, Jordan, Compass, and Howell 1994, and Skills, Bukwala, Naps, all these people they studied on the psychosocial factor of the cancer. What they're saying about it, when the person is using lot of tobacco, or a healthy diet, or reproductive, or sexual behavior, and alcohol use related cancer, it, and it depends on the individual health system, health beliefs also. Those are the psychosocial factors for cancer. And even when the person is um, got cancer, the stress level will be more. So here we need to see the initiation of cancer, while other stress increases the promotion of cancer. Actually, whenever we are identifying and intervening the early stage, survival cost will be more. Okay, now we will see what are the psychological consequences of that. See, whenever the person suffered with suffering with the cancer, okay, it depends. If it hurts them, even it affects their high quality of lifestyle. Okay, if the person is maintaining good lifestyle, and yeah, he can live with the cancer for very over long period. Okay, if the cancer is now a chronic disease, and reaction to cancer varies across the different individuals. Some people they will fight and they will survive. Some people they can't fight and they will go. Okay, and not only that, this cancer also like generating the fear stigma, I think. Okay, means all the patients whenever they listen, they hear the word of cancer, they will this stigmatizing factor like fear generates, and we need to see the actual progress how it's happening and all. And yeah, the result will be like and body functions also it affects the body function and they even the families and even the caregivers, even the person also they experience depression and they even experience irritability, fear, withdrawal, anger, and hostility, and denial also will be there. Even body images also, individuals suffering from cancer, especially those are diagnosed with breast cancer and head and neck cancer. Body image also it suffers them a lot. As a result of the diagnosis of cancer patients, actually it's disrupted the postpones. And not only that, it affects their career path and even academic and social independence of the individual. Yes, even the relationship also suffers. Most of the families they don't support. If they're supporting, also the treatment is very expensive. Though it's it resulting into the financial strain of the patient, and yeah, the relationship issues also will be there. And most of the time, the potentiality life-threatening condition will be high. Mr. Hall in 1989, he described four phases of coping during the clinical course of cancer. The first phase is cancer identified as the phase an individual may experience anxiety. And yeah, it may serve as a motivation to seek the medical attention or lead to denial and result in the treatment delay. Okay, this is the first factor. In the second phase, most of the time where the definitive diagnosis of cancer is made, at this phase, individuals may experience significant emotional distress or display problem solving attitude. Actually, here the people will understand and they will go with the necessary cure. In the first condition, denial or accepting. Second condition, they'll go with the care. The third phase involves treatment and adjuvant therapy. Whatever the possibilities are there, individual express positive feelings to overcome their situation. They're ready to battling the disease. Okay, this is in the third phase. So here people are completely ready and they will understand the cancer. They will know how to take care of their future. Okay, they work upon that. So here coping with cancer is an ongoing process in which individual coping influenced by outside forces like family, resources, And intrinsic is capability, their self-efficacy and confidence. One is external, other one is internal. Suppose if the person is very strong, yes, he will. That is comes under third phase. Now, what is the role play of psychology in cancer symptoms? See, whenever we are hearing the cancer word, the people will tend to get often they have the distressing pain and difficulty in breathing. Vomiting sensation will be more, and yeah, sleeplessness. I mean, they will think more, and loss of bowel or bladder control, loss of appetite, difficulty in breathing, vomiting, and mental confusion. They can't take any kind of decision. They always have the confusion state. So all these things will be there. It elevates the symptoms and improve the quality of life. So here we need to do the interventions to by using the biofeedback to help the patients to decrease the pain. I mean, here the pain element will be more. That's the reason we need to monitor and we need to understand the severity of the pain. Then we need to help the person. Okay, all these things we need to take care. And here we need to see the different coping skills related to pain. We need to work upon with the patients in a positive manner and we need to take care of that. And what are the psychologist says, and we need to support the social interventions. And yeah, we can join even with the group therapies, and we can see when the person is undergoing through chemotherapy, nausea sensation and vomiting will be there more. So here we need to prepare for the person. Whenever the person is sensing this, you will get antiseptic nausea and all. And we need to help the person with the responding conditioning and visual imagery, and we need to make the person to be more relaxed, and we need to help with the person desensitization. Actually, all these things, it will reduce the symptoms of vomiting, nausea, and other things. Is even the body image issue. When the person is suffering with the breast cancer and all other things, we need to prepare in advance. And the body image counseling they have to do. And yeah, we can help the person. Body can improve the quality of life. So here, cognitive adaptation strategies also we need to give, and we need to focus on the self-worth of the person and even their ability to give the meaning to their life. So whenever we are dealing with the cancer patients, we need to show the examples of cancer survivors and how they're dealing with their day-to-day stresses. We need to, the stories of their patients will help them to deal the cancer in an effective manner. And not only that, most of the cancer patients have a aggravated stress. So here we need to make them calm and we need to give the examples of success stories. So these are the things and how to deal with the cancer. Now we are going to focus on the HIV AIDS. Okay, whenever we are seeing this is called immunity deficiency syndrome, human immunity deficiency virus, HIV. AIDS means acquired immunity deficiency, means this. Actually, in 1970s, and it spreads rapidly. It's began with the Central Africa. Tyler 2015 he studied, and HIV targets immune system. That's the reason the name itself acquired immune deficiency syndrome. Okay, so here, what is this affects? It affects the kill CD4 cells, HIV infect. Okay, actually it affects the immunity cell, and if it is affecting that, that is called T cells. T cells mean lymphocytes. Actually, here the T cells immunity called mediated immunity are protected and against the intracellular agents such as viruses and all. So here, what is this affecting? It affecting our immune deficiency. So here, significant loss of T helper. Actually, here, whenever we have this, we'll recognize the immunity system abnormality resulting from HIV infection. Actually, this depletion of the T cells, what will happen here? The profound immunity suppression, it causes AIDS. Okay, which is the most advanced stage of HIV infection. So here, actually, to take care of this, even the treatment also, 2 to 15 years it will take, depends upon the severity of the case. And yeah, it depends the certain cancers, infections, and other severe clinical manifestations also because our immunity system is affecting. So it may reach the next level to the cancers and all other infections also. So whenever the person is hitting this acquired immunity deficiency system, AIDS, okay, we need to, the symptoms may be vary. And not only that, in the first few months, only infection will be there. People may not experience any symptoms. They are not aware of the status. It will be normal. So actually what will happen in this case? Progressively it affects and the weakness and weakens the immunity system also. Here the symptoms such as like swallowing lymph nodes, weight loss, fever, diarrhea, and cough may also appear. These are the few symptoms we can understand. We can see the person. And it may lead to the severe illness such as tuberculosis and cryptococcal meningitis, severe bacterial infection, and cancer such as a lymphoma and capsulocytoma. We already discussed these. Now, how this transmission HIV, how it transmissions. Okay, actually here for by injection, drug use with sharing. That's the reason whenever people are taking the injection and all, we need to be careful. And breastfeeding is one of the reason. First one is the person to person through fluid exchange, sexual behaviors, use of HIV contaminated injection, mother to infant during pregnancy, labor and delivery or breastfeeding through transfusion with infected blood or blood products. First, how the blood transfusion is happening. Blood or blood parts from an infected person enter the bloodstream. Anal intercourse, yes. We will discuss this is most of the time it affects like that towards the intercourse and various presence of the blood and STS, lactances and stages of HIV. Okay, semen or blood also it enters to the absorption of microbe. And vaginal intercourse, even infected semen or vaginal fluids also it affects, it leads to that. And varies the presence of blood and STIs and yeah, lactose and stage HIV infection and oral genital contact. Infected semen or vaginal fluids enter the bloodstream through micro opening in that oral cavity or infected cells enter the vagina or penis through micro opening. So this is also one of the reason. And perinatal transmission. Actually here the transplacental transfer of virus during the gestation. Actually here the transfer of virus or maternal blood during. Actually here when it happens in the time of labor pain or delivery time. Even the breastfeeding also. And needle stick injury. Most of the cases it happens through needle. Occupational injury in medical settings. That's also one reason. I think nowadays it's not there when pani puri through cutting the by eating the person the person is suffering with the pani puri wala with AIDS and he's cutting the onions and his blood is getting to that, so people got that. Those are the things are there examples. So here we have to be very careful. And what are the diagnosis and treatment of HIV? Actually, most common thing is to diagnose is blood test. Okay, blood test. That's the reason even people, whenever they got married and when they are planning for the kids, and they will go with the blood test. They will check HIV, is there or not there. And also it can be the anywhere from 6 weeks. Actually, we can see the antibodies to develop within 6 weeks, the virus and all. So actually, this is very crucial time for early treatment. People can also use it test themselves by using the provider of food. Nowadays, a lot of tests were there. We can go with the self-test also. Actually, approximately 37.9 million are living with HIV by end of the 2018. This is a survey as done by WHO in 2019. Okay, here the middle income countries, most of the affected countries are middle income. In 2018, 62% of adults, 50% of children living with the HIV. This was done by WHO in 2018. So here the greater majority of pregnant and breastfeeding women living with HIV also viewed as an art. Now we are going to discuss about the psychosocial impact of HIV infection. How this psychosocial impact is affecting. Whenever the person is facing these issues, they have a lot of challenges in the psychological. One common effect is depression, and they don't get any kind of social, and the stigma is there because most of the people they will see this person got to sexual preference or race. Okay, so here they don't help, and they will try to avoid and coping strategies and those who exhibit the more symptoms. And not only that, older patient with HIV or poorer well-being and higher depression than younger patients. So all these things also it affects them. And yeah, especially among the socially isolated infected people, like they may get tend to get a lot of ideas about the suicidal and all other things because of the social stigma, and they have the anxiety, shame, anger, guilt, and the alienation. All these things are there. And the sometimes even if the person is suffering with all these things, the prognosis will be very less. And a sedentary lifestyle is also one of the reason. And adherence to medication, stress, cognitive adjustment, and the type C coping styles, it plays a role in disease progression. So these are all things will be there. This effect will be more and more on the person who are suffering with HIV, and they will always go with the why I have done the unsafe sex and all. They didn't even expect. So here, due to the success, heart highly active antiviral therapy. Okay, this therapy will help, and life expectancy and the quality of life. Those HIV is improved nowadays. People are giving lot of mm, solutions, and they are training how to take the drugs to in the difficult situations, and they're explaining the drugs effectiveness, and life stress is linked with the illness progression. So here they need to maintain the stress management intervention techniques, uh, the person who are suffering with HIV. And even Antonia in 2006, he studies stress management and adherence to art medication. Actually, this one is concluding most beneficial effects to overcome this situation. So here, the role of adjustment among the people with HIV shows most of the time it managed by the following death of the partner or close friend or maintain the level of a CD4, means the helper cells to follow theirs. So here, the person needs to work upon his coping style, type C. And here, whenever the person is having lack of emotional expression, may exacerbate the course of HIV disease. That's the reason we need to speak the person and we need to understand his emotion. We need to vent. If the person needs to ventilate. So here we need to give a lot of centers are there. Even the telephone calls, telephone center is there to help the people. And yeah, nine some centers are there. They will listen. Okay, they'll explain the diet, how to follow, and how to. They will help the person quitting the smoking or reducing the smoking and avoiding the drugs and all other things. And even they will help the person how to social conditions like what are the things if affecting. They will give the taking care. And next, we'll discuss about the palliative care. Actually, World Health Organization defined palliative care as an approach that improves the quality of life of the patients and their families also, when who all are facing these threatening issues or illness. Okay, here the first thing is we need to understand the pain and other problems like physical, psychosocial, and even the spiritual. Okay, here the palliative care may be offered to individuals with an illness such as cancer. Okay, even like health diseases, lung diseases, kidney failure, dementia. Okay, and any ALS, amyotrophic lateral sclerosis. Okay, actually, when the person is under palliative care, right, the person needs to remain under the care of the regular caregivers and still receive treatment for their disease. Actually, caregiver role will be more. Okay, even the palliative care consultation team is a they are like doctors, nurses, dietitians, social workers, and psychologists will be there. And they will they are the massage therapists also there. They will work in the palliative care. And even spiritual leaders also sometimes. Actually, when they are working with these patients and the family members, the patients and the other doctors, they need to help the medical and social and even the emotional and practical support to the person. Okay, now we will see what are the things they are following in the palliative care. First thing, these are designed by WHO. Okay, first thing, to provide relief from pain and other distressing symptoms. See, whenever we started the palliative care, we need to focus on the pain management. Others, what will happen? Even the distressing symptoms also. Suppose if someone is coming and is telling lot of negative things about his towards his, it affects his more distress. So we need to work upon that. And to affirm life and regards dying as a normal process. And we need to intend the neither to hasten or postpone death. We need to explain. And the next following factor, to integrate the psychological and spiritual aspects of patient care and to offer a support system to help patients live as actively as possible until death. Next one, to offer support system help the family cope during the patient's illness and in their bereavement. Next, actually, this team approach to address the needs of the patients and their families, including bereavement counseling, if it is indicated. Next, they work upon the enhance the quality of life and may also positively influence the course of illness. All these things they will work. Now, what is the pain and its impact? Why pain play a role? Suppose whenever the person is suffering with the pain, he is unable to deal anything, emotional distress will be more. So because of the pain, when the person is unable to take the pain, they may get into the suicidal thoughts and all. And not only that, if the pain is chronic, they will get the acute episodes. So here we need to understand. Actually, for pain is defined by the International Association for the Study of Pain, IEASP, in 2014, an unpleasant sensory and emotional experience associated with actual or potential tissue damage are described in terms of such damage. Okay, this was the definition of pain, an unpleasant sensory and emotional experience, which is associated with the actual or potential tissue damage that described as such damage. So here, when the person is under the chronic pain, here we need to see the recurrent accurate pain and chronic progressive pain. If the chronic progressive pain is there, we need to go with the 6 months or more and unresponsive to treatment. Okay, we need to tell them. Suppose someone is actually when the person is into this, we need to say not to respond for next 6 months. That means we need to prepare the person, the patient. Please bear with the pain for next month, 6 months, like prepared. And recurring chronic pain is an intermittent episode of the pain that is acute in character but chronic in as much as the condition recurs from 6 months. Example, migraine headache. Okay, even the chronic progressive pain persists longer than 6 months. Here we need to see the severity. Okay, what is this pain? How it's typically associated with what are the disorders? What kind of a pain it is? Is it rheumatoid or arthritis? In that case, the pain will be more. So we need to make the patient to understand and we need to prepare him with the pain. So whatever the painful situations are there, we need to detect. Suppose burning the hand, burn the hand. That is also, we need to understand. This one is developed by Mr. Von Frey. He developed in 1895 sophisticated theory of pain, which is like describes. He suggests that there were specific sensory receptors sensitive to specific stimulation. So here, whenever we are working up the sensory receptors, we need to see the transmit touch, warmth, and pain. Okay, this model is developed by Mr. Von Frey. Actually, we do have another model that is called pain pattern theory. This one is developed by Mr. Goldskinder in 1920. He suggested that whatever the nerve impulse patterns determine the degree of pain, and the messages from damaged area were sent to directly to the brain through the nervous impulse. Okay, here what happens? He introduced this psychology to understand the pain and magic involved. Actually, he developed the theory, gate control theory of pain, which much disgrades. But here he suggested that whenever the person is having the specific sensory receptor sensitive to specific stimulations. Okay, here the specific sensory transmitters like touch, warmth, and pain. So this was done by Mr. Von Frey. Another model developed by Mr. Goldfinger, he suggests that whenever the nerve impulse pattern determine the degree of pain and that massage messages from the damaged area. And yeah, it even affects the nerve impulses. And here we need to see uh, this one is done by Mr. Wall, 1965. He developed the gate control theory of pain. Okay, here he suggests that spinal cord contains neurological gate that either blocks pain signals or allows them to continue on the brain. This gate can be opened and closed by several factors such as physical factors, injury, medication, emotional factors like anxiety, happiness, behavior factors, boredom, distraction. All these things also affect the person. Next, we are going to discuss about the impact of pain. Actually, here, whenever the person is suffering with the fatigue and emotional distress, even because of the pain, along with the pain, okay, here Mr. Sarja et al. 2014, and he experienced patients whenever the cancer, okay, it may be cancer itself or types and stages of the cancer. And even the tumor also presses nerves in the spinal cord. It can result into the severe pain of our back and neck. So here we need to take care of the person, and whenever the person is experiencing the pain, we need to go with the medication. At the same time, we need to make the person to understand. So few people, whenever they're eating in the trouble and drinking also, we need to make them to understand. We need to prepare them, and we need to see their psychological and physical impairments. Okay, and even at the same time, we need to associate with the person is associated with depression, anxiety, and even social ideation, or poor sleep, or impaired concentration, or dissatisfaction, health, and poor overall quality of life. Actually, this was done by the study by the New to Transfer, Sirjal et al. We have to see the impact of the treatment. And we need to focus only on the recovery of the patients without affecting all these elements. And we need to make them to understand these things are happening with you, please take care. And we need to make them therapy to understand. So that what will happen here, the body recovers fast. At the same time, they experience, whenever they experience the chronic pain, they will understand the effects of HIV, and yeah, they will take the neuropathy, which is never damaged, like cancer, opportunistic infections, and treatment of HIV. They will plan for the therapies and the pain management things. Even when the person pain is intensity is more with the AIDS patients, actually, which associate with the psychological distress, not only the depression, hopelessness, and quality of life. Actually, this study done by Mr. Arjunal, Rosenfield, Berbert, and McDonald, Pasic, Tyler, all these things they have done, the study. Actually, here they're saying the treatment and recovery of the patients, that impact will be there on this. So here, whenever the person is, patient is going with this through, this is mostly uncommon, and actually it's reported and experience the pain. So some experiences are short-term pain as a result of infection, injury, or surgery. Okay, here we need to see how the body is recovering, and we need to see how the pain is managing and what kind of impact will be there. Now we'll discuss about the community issues of and related to caregiving. See, when the person is suffering with community this thing, and here we need to take care of the formal caregivers like doctors, nurses, and other health professionals, whereas informal caregivers include family members, friends, neighbors, or partners. Sometimes what will happen because of their caregiving experience is rewarding and enriching. And not only that, they will, few people, they will give a negative impact on them, few people, they do the positive impact. See, whatever the negative impact will may lead to the person to distress, anxiety, and depression, burden, stress, and burnout also. Now we have to see the caregiver stress. See, we always discussing about the patient, but whatever the caregivers, actually caregiver stress also more. Why means he's the one and only person who is taking care of. So here it affects like biochemical, behavioral, psychological, and psychological changes caused by the external factors of the stressor. Actually, here the response of the individual to the stressor is defined as a stress or distress depending upon the situation. Actually, here even the differentiation between the harmful and damaging stress is called distress. And positive and beneficial stress, eustress. Okay, here Lazarus and Laurie in 1978 developed the most common definition in which the regardless stress is transaction between the people and their surroundings. Okay, even the physical symptoms of caregiver stress may include the headaches, sleep problems, tension, weight changes. All those things will be happen. So here we need to understand how the HIV/AIDS and what is the response and how the professional level we can deal and what are the short term and long term goal for the anxiety, even for the depression. When the person is suffering with helplessness and anger and he is unable to do the household things, and we need to help the person at the same time, we need to give the stress of caregiving in a cancer is caregivers emotional and physical well-being. So here we need to take care of the caregivers emotional and even the emotional effect like worrying, anxiety, and being irritable person, the caregiver, to make them to understand. And we need to tell them not to bother. These are the symptoms because of the symptoms, because of the symptoms, he's suffering with the pain. So actually, even the caregiver also, most of the time they may suffer with tension and sleeping disorders and loss of weight, or they may affect the immunity system and all also. So here we need to educate the person. That's the reason we need to give the caregiver burnout. What is caregiver burnout? Here, behavioral symptoms of burnout include irritability, short temperament, paranoia, paranoia, and towards other staff. Okay, here the caregiver always may get into the cynicism, becoming unreasonable for constructive changes and inflexibility. They are not flexible and more stubborn will be there. Okay, because they are the one who is taking day-to-day stress and they are managing the person and they are managing his temper tantrums also. Because they will get into the emotional exhaustion and depersonalization and feeling of low self-esteem. One is they are seeing every day and they are facing the challenges. They do face the financial, emotional challenges. At the same time, they're seeing the pain, and these things also affects very much. Most of the spouses also they can't handle the things, and they will have a lot of they'll go through a lot. So this is all about the caregivers. Sure. Next session we are going to discuss about patient practitioner relationship. Okay, I'll wind up my class. Thank you. Good day.